Air quality and you, how to protect your family.
We all know that the quality of the air that we breathe can affect the health of our lungs. But did you know that children's lungs and their metabolic system is less developed than adults? This puts them at an increased risk for certain respiratory diseases. There are some indoor triggers for respiratory disease and outdoor triggers for respiratory disease. Some indoor triggers, for example, are cockroaches, dust mites, pet dander, poor ventilation in the place of living or where you work, cigarette smoke, mold, and then some outdoor triggers are smoke, ozone, vehicles, housing near factories or major roads, and natural disasters such as heat waves and wildfires.
These triggers can unfortunately lead to respiratory diseases. Children in particular are at greater risk of the following respiratory illnesses related to environmental triggers. These respiratory illnesses include allergic respiratory diseases such as asthma and allergic rhinitis. They also include acute respiratory infections such as pneumonia, bronchitis, RSV, influenza A, and rhinovirus. Disordered breathing during sleep, such as wheezing and snoring, and chronic lung disease, such as emphysema and lung cancer.
What can we do in terms of prevention? We can use mite impermeable bedding covers, which have shown to lower house dust mite count and reduce the need for inhaled steroids in asthmatic children. We can use high-efficiency vacuum cleaners rather than the standard ones, as they are shown to significantly reduce house dust and dog allergens compared to regular vacuums. Open windows while cooking for humidity control if there are no exhaust fans available. We can also implement smoke-free rules inside as well as smoke-free rules outside, which can improve the health of our children and the whole neighborhood. Opt for central heating if possible, as it has shown to reduce dampness and improved energy efficiency in symptoms of asthma and nocturnal cough. Make sure children are up to date on their vaccines. Dust and clean the home regularly. Inspect for cracks in basement walls, as they allow for more radon to get into the home and for moisture to accumulate. Radon is a naturally occurring odorless, colorless, tasteless radioactive gas that increases the risk of cancer. And lastly, use an air purifier in the home, which has been shown to reduce airborne cat and dog allergens, which improved peak expiratory flow rate.
Let's figure out how to put on a mask for a child. To apply the mask, find the top edge of the mask, which usually has a thin metal strip along the edge. Hold the mask by the ear loops, with keeping the top edge above the nose and the folds pointing down. Put the ear loops over your ears. Gently pinch the upper metal band around the bridge of the nose. Make sure the bottom of the mask is well under the chin. If you've done this right, your mask will now protect you against a lot of different allergens such as dust, smoke, and the common cold. There are medications that are commonly prescribed. Antihistamines such as Zyrtec or Claritin, corticosteroids such as Flonase or Demista, nasal decongestants such as Atrovent, leukotriene receptor agonists such as Singular, which is used to prevent asthma from getting worse. Anticholinergic agents such as Spiriva, antiviral agents such as acyclovir, or beta-2 adrenergic agonist agents such as Ventolin, which is your inhaler. Let's learn how to use an inhaler for your child with a spacer. When you're using an inhaler, it is important to remember that your child will eventually be able to do the inhaler themselves. Start by removing the mouthpiece cover from the inhaler and the spacer. Shake the inhaler well for 2 to 5 seconds. Insert the inhaler into the end of the spacer device. Put the spacer in the mouth of the child around closed lips. Have the child breathe normally through the spacer device mouthpiece. Press the medication canister, spraying 1 puff into the spacer device. Watch as the child breathes slowly and fully for 5 seconds. Instruct the child to hold their breath for 10 seconds or as long as they can. In 20 to 30 seconds, have your child do the same thing again if you're using the same inhaler. Your child may feel gagging sensation in the throat caused by the medication on the pharynx or the tongues. After about 2 minutes from the last dose, have your child rinse their mouth out with warm water and spit it out. We've covered a lot today, but it's important that you remember a few things even with everything we've covered. It's time to call 911 if your inhaler isn't working after 2 doses or whatever your doctor orders. If your child is running a temperature, if they're under 3 months old, that temperature is anything over 100.4 Fahrenheit. Or if they're 3 months or older, that temperature is now 102.2. If your child shows signs of confusion, or if your child has new signs that they're having a hard time breathing, any of these signs are an emergency. Please go to the hospital as soon as you can.